Hi, my name is Dr. Brian Mailing, and I'm going to be answering your questions today from Reddit about stem cells and regenerative medicine. So I got a bunch of interesting questions here, and I'll try to get to all of them. Can we regenerate heart muscle with stem cells? So there's different types of heart disease. Most dramatic is the ischemic heart attack, where you have a loss of blood flow to a portion of the heart. That's typically a very sudden event. But there's other types of heart injury. Sometimes the heart just gets weaker with time. Sometimes it gets stretched out. People can have valve problems or plaques of material that form in the vessels. So there's all different types of heart problems. The heart muscle can just become weaker with age. In our experience, it looks like the stem cells can help regenerate almost any tissue in the body. So I do think that the stem cells can help regenerate heart tissue. And the way we've and other researchers have seen it is an increase in ejection fraction with a stem cell treatment. So it's been reported that patients have an increase in ejection fraction with stem cell treatment, and we've observed that. And so it does appear that stem cells would help regenerate heart muscle. So the next question is stem cell therapy for migraine headaches. So we do have 2 patients that had really severe migraine headaches that did the stem cell treatments, and both of them noticed a very significant reduction in the incidence of the headaches. So one patient was basically getting migraine headaches at least a couple times a month, was on medication for it, and really it was pretty debilitating. She did one IV infusion, I believe with a mannitol to get more into the central nervous system. And she had her longest period without a migraine headache in her whole life after that treatment. Eventually, unfortunately, she did develop migraines again, but they were of much less severity, and the interval was longer between the headaches. We had another patient who also suffered from severe migraine headaches, and he had essentially the same result. So after he did one IV infusion plus mannitol, he noticed an extended period of time without a single headache, and then ultimately he did have some headaches develop, but they were much less severe, and the interval was much longer. So I would definitely recommend an IV plus mannitol infusion for the migraines. It looks like it probably needs to be repeated every couple years because, again, everyone has an individual story, but the more severe it is, you might even need more than one treatment, but it does seem to be very effective for migraine headaches. Next question is on stem cell therapy for eczema. So eczema is an autoimmune disease, and it is typically manifested on the skin. Okay, I'm sure we all have friends or people we know with eczema. So it can be really problematic to treat. Sometimes people turn to like immunosuppressive drugs, which have other problems because it leaves you open for other types of infection. And it can also result in other conditions in the body, such as arthritis and things like that. So at Blue Horizon, we have both a topical skin cream, which uses conditioned media, which several of our patients with eczema have noticed a pretty dramatic improvement in the skin manifestations of the disease. And then we can also treat it with an IV infusion of the cord blood stem cells, which the cord blood stem cells seem to have an immune modulating effect. We don't know exactly how, but it seems that autoimmune diseases are particularly effectively treated with the cord blood stem cells. So this being an autoimmune disease, we would expect to have a significant improvement. So a typical regimen that I would recommend for an eczema patient would be to start out with our Alpha Blue cosmetic, which has the conditioned media. Conditioned media is what we grow the stem cells in. So when we culture the stem cells from the Wharton's jelly, they release cytokines and growth factors into this culture medium. And we used to just throw it away because you switch it every couple days so the cells have fresh growth medium. But then we thought, well, maybe there's something in there, maybe we should check it. And sure enough, there were 32 cytokines and growth factors in there. And we incorporated it into a cosmetic. It's manufactured in Germany. It's amazing for just, wrinkles and dry skin and stuff like that, but it also turns out to be particularly effective for all kinds of skin conditions, especially stuff like eczema. So eczema seems to be particularly well treated with it. And so we've had a lot of patients that reported improvements with just the cream. If that doesn't work, then you could add a cord blood IV infusion. That would be, I think, a much stronger treatment, but the two together would be ideal. And so that's, I think, the optimal prescription basically for eczema patient. Also, the cord blood would be much more able to help like a arthritic condition or something else related to the eczema that's not just on the skin surface. Thanks very much. I really enjoyed answering everyone's questions today. So if you have any additional questions or comments, anything I could clarify more, just leave it in the comments section or send me an email. Thanks very much.